Life without masks will soon be a reality for many. Ontario's top doctor says the province is lifting a number of public health measures in the coming weeks, including mask mandates in most public settings and schools.
The change is set to take effect March 21st, and it's leaving Ontarians with the choice to wear one or not. As Nicole Martin reports, it's a decision that prompted a great deal of criticism from teachers' unions and hospital coalitions.
In a matter of weeks, signs like these will be coming down.
We are now learning to live with and manage COVID-19 for the long term.
Dr. Kieran Moore says improving health indicators like hospitalizations declining by 81% since January have allowed for masks to be dropped in most public settings come March 21st.
We've seen slow and steady declines despite opening up.
We've been super cautious. As a matter of fact, I've been probably accused of being the most cautious leader in North America when it comes to this pandemic.
But when it comes to masks being dropped in schools, the Children's Health Coalition, including McMaster Children's Hospital, says it would have preferred to see masks kept in place for 2 weeks after March break.
We think we need to slow down.
The Elementary Teachers Federation says the majority of their members are worried.
We're lifting the masking mandate. We're lifting the cohorting mandate. There's no social distancing happening. And for our members in elementary education, where 55% of the children between 5 to 11 are not vaccinated, that's a huge concern.
Masking will remain in place for public transit, long-term care, retirement homes, other congregate settings, and within the healthcare sector. But that could change on April 27th. Dr. Kieran Moore says at that time, all remaining masking rules will be lifted and all other public health measures will end. The Registered Nurses Association says this is not the right time.
Uncalled for, unnecessary, and a political decision not based on science.
The CEO of Hamilton Health Sciences tweeting a reminder ahead of March break. Public health modeling predicts we'll see another increase in COVID hospitalizations between now and May. We're not out of the woods yet.
Basically, the decision today was let the most vulnerable protect themselves.
Premier Doug Ford saying ultimately the choice will be yours.
It's going to be up to the people of Ontario. If you want to keep your mask on, keep it on. If you want to take it off, take it off.
The Chief Medical Officer of Health is still encouraging anyone who is vulnerable to continue to wear masks once the mandates are lifted.
I will do a risk assessment for high-risk indoor settings, so if I go to the Eaton Centre, I'll wear my mask.
Dr. Moore is asking Ontarians to be considerate of those businesses or individuals who choose to continue masking going forward. Hamilton Public Health is currently reviewing the announcement and will have more to say in the days ahead. But Niagara's top doctor is already telling us he disagrees with the province's decision here to end most mask mandates, saying it's not the right time, that it's too soon. And he's encouraging residents to continue masking even after March 21st.